Hi everybody. This is the re-record for the inflammation video for the immune system. Inflammation, we're talking about the innate immune system and the mechanisms that's used within the innate immune system to deal with pathogens and things like that. So let's see. So what is inflammation? So let's see. Red seems like a good color. Whoa, that's not good. Sorry. So inflammation. So inflammation is basically a condition that's marked by symptoms of redness, swelling, heat, and pain. Okay. It is initiated by something called cytokines. Okay, and inflammation is part of the innate immune system. It is not necessarily a bad thing. Okay, chronic inflammation can be not so good, but inflammation is something that we do need, and it starts by these chemicals that are called cytokines. So what is a cytokine? Let's use a different color. All right. So a cytokine is a substance. So it's a chemical that is secreted by certain types of cells, so certain cells of the immune system, and these chemicals have, we'll say that have some kind of effect, so an effect on other cells. Okay. So what kind of things produce cytokines? So what produces cytokines? Why do we get inflammation? All right. Well, cytokines are produced by basically tissue damage. So injury, I'm sure, most people have had a sprained ankle or something like that, or a cut or whatever. And the inflammatory process is the first thing that happens that helps to isolate the injury, localize it, and provide sort of cleanup and facilitate a situation for healing. Okay. Pathogens can also stimulate cytokines to make inflammation. Okay, so getting the common cold, and you get different symptoms from the cold. So inflammation can be a bad thing, but it's also a good thing. So what is the purpose of it? What does inflammation do? Purpose of inflammation. So the first thing is it creates a barrier. So it tries to localize and ward off the infected area from moving on to healthy tissue. Okay, so it creates a barrier between injured tissue or pathogenic tissue and healthy tissue. Okay, it brings in help. So it brings in white blood cells. So white blood cells we need for clearing out bacteria, cleaning up the place, getting rid of debris and things like that from the injury site. Okay? And lastly, it promotes healing. So it facilitates a situation there where that injury can heal itself. Okay? So what are the symptoms of inflammation? Well, they're up here. Redness, swelling, heat, and pain. So, I'm going to use a different color here. All right, so swelling and pain. So basically in inflammation, when the inflammatory reaction occurs, the vessels in the area become permeable. Okay, so it increases permeability of vessels, capillaries. So it increases their permeability so that we can get white blood cells and proteins and things like that into the area. When the vessels become permeable, then fluid will leave the vessel and enter the interstitial space. Interstitial space. I'm trying to write fast. Okay, interstitial space. The more fluid that enters there, the more swelling we're going to see. And swelling, when the tissues, the fluid is accumulating there, it'll press up against nerves that are in there, and that's painful. So we get swelling and pain there from that increased permeability of the capillaries in that area. But the good thing about it is it kind of walls it off. And some say that the other, or the fifth main symptom of inflammation is lack of movement. But I think that the pain and the swelling keeps you from wanting to move that particular injured area. Okay, so some people say that is, and some people don't. But I think that the symptoms that you get keep you from moving that thing. Okay, so the next thing we want to look at, of course, is the redness and heat. So where does that come from? So basically what's going to happen is we need to increase blood flow. Because we're bringing stuff in. We're bringing white blood cells. We're bringing maybe some proteins, for blood clotting or whatever. So we got to increase the blood flow. And to do this, the vessels near it will vasodilate. Vasodilation, bringing more blood to those capillary beds, those areas where the tissue is damaged. So this will bring in white blood cells and proteins, whatever is needed to clean up, get rid of bacteria and things like that, and start the healing process. So remember, I have my little vessel here. So the vessel, remember, the capillaries are just endothelium. And so that means these cells are going to be simple squamous cells. They're going to become more permeable. And when they're more permeable, fluid will leave just due to the blood pressure, the hydrostatic pressure. It will push more bulk flow of fluid out into the interstitial space. That will cause the swelling, and it can cause some pain as well. And then, of course, we need to bring in those white blood cells here. And remember, we talked about, I think we talked about chemotaxis and diapedesis. So this is what happens. You've got these white blood cells that are going to cling to the edge of, or the wall of the endothelium, and then find their way out into the interstitial space where the injury is, and go to clean up, things like bacteria and stuff like that. There'll be neutrophils, there'll be monocytes. When the monocytes go into the tissue, they become macrophages, so they can handle lots of bacteria, and they can also become presenting cells if the injury becomes more systemic. When these cells and proteins, like put a few proteins there, as they move out into the interstitial space, more fluid will follow, and that of course will cause more swelling. Okay, so that's inflammation, and in and itself, it is not a bad thing. It is a good thing. What happens with inflammation that becomes a bad thing is when it becomes chronic, and when the cytokines are working overtime and barfing out, chemicals over and over and over in an area. So that will cause some problems rather than good things if it's a chronic thing. But by and large, when you have an injury, inflammation sets the stage. That's what we say, and it is a good thing. All right, I think that's about it. Make sure you remember the key symptoms: the redness, swelling, heat, and pain, and don't forget why they happen and what causes them to occur.